Welcome back. Christopher Laco, the Vice President of Operations, joins us. We're going to talk more about this app. We're actually going to see how it works, which is really cool. Why did Penn State Health decide to do this and develop this app?
Sure. We developed the app so that we could connect with our patients and providers 24/7, either for an acute care visit or for a scheduled patient visit. Really wasn't meant to change the way care is provided, but rather to augment the way we provide care.
Can anybody sign up?
Yes, app is free to download. You can download it in the Apple Store or the Google Play Store. You can also go on PennStateHealthOnDemand.com and register there as well.
Okay, let's talk about how it works. You're actually going to poke around a little bit and show us.
Yep. Yeah, so once you download the app and you've registered it on the system, you actually can log in with your username and password. And it should take you right to our urgent care on demand, which we use for things like rashes, fevers, earaches for kids. And it will actually provide you with a list of providers that would be available to see patients today. And if
so these are not the folks who are online with the app right now, or they are?
These are actually physicians who are ready and waiting. And if you look at the first physician up there for adult medicine, he's actually ready and waiting right now. Several of the other physicians that are there are actually waiting with patients, probably treating someone, and then there's one in their queue.
So what happens when you tap one?
Yeah, sure. We can go right to the first one here. It'll actually bring up a profile of the physician, talk to you a little bit about what that copay is, the languages that are spoken, where you went to med school, how many years of experience. And then if you were to go forward, and I will, but it would put us in a virtual waiting room.
Okay.
The next step in the process actually would be some intake questions. So why would you be calling in today? What would be your signs and symptoms? That would prompt the physician, so when they're ready to get online with you, they kind of had an idea of what you're going to be treated for that day.
You mentioned that copay. What is the cost for using this? Does it work with insurance?
It does. It will work with some insurances, and I would encourage viewers to check with their insurance to see what the copay would be. Oftentimes it's the same as a doctor's visit for an acute care visit. And if you don't have insurance, you can always use a credit card and pay $49 for the visit.
So again, anybody can use this. You don't have to necessarily be right here. You don't have to be in Hershey. Like, let's say you're on vacation or your child's on vacation. You're out of the area. Can you log on the same way?
Yeah, absolutely. That's the beauty of the app. It's portable. It goes with your device. Again, tablet, iPhone, Android phone, or desktop PC, anywhere in the contiguous 50 U.S. states.
That is really something. I mean, do you see this going even further? Like, what do you hope maybe the app ultimately will be able to do?
Yeah, so beyond urgent care or on-demand type care for acute issues, we are actually using the technology to power some of our other telemedicine services. So Dr. Simmons' service that you saw earlier is now live using the on-demand app, easy to use for patients, and that can connect the provider with the patient in their own home.
Years ago, like I was mentioning the last time around, like years ago, could you ever have seen this? It's tremendous.
Yeah, I mean, the technology really has come a long way and continues to evolve. The marketplace is ripe for different types of technology. So this is just one of many that are out there.
One concern, HIPAA, security.
Yep. So the security concerns, most of these vendors that we work with, even our own, function at the highest level of cyber. We have a full cybersecurity team on staff at Penn State Health, which assures before anything is turned on that we don't have any holes in the Swiss cheese, per se.
Very good. Thank you so much.
Yeah.
So neat. Thanks for showing us how it will work. Well, if you want a question answered about the app, about telehealth, you can ask your question right now. Go to our live web chat at abc27.com/telehealthchat. The chat does continue until 11. We'll be right back.